shocker, recording from my home. And we are with Jeff Stevens, who is in his office.
How you doing,
Hi.
Patty?
Good, Jeff. How's it going?
Good.
Thank you so much for doing these weekly updates. I think the residents really appreciate it.
Well, I'm happy to do it. And there's sometimes good information that people will get from you that they don't see in other spots. So I'm happy to be a part of it.
Excellent. So let's dive right into it. What are the recent numbers in the area in Westford?
All right. So Middlesex County is reporting a number of 4,045 right now of people that are infected. And I always like to go locally with our numbers. And I'll just remind everybody what we have today may not even be the same numbers that are reported tomorrow morning. So it's an extraordinarily fluid situation. Currently today, we have in Westford, 38 total cases have been reported to the town. We have total 25 active cases, and we have 11 cases of people that have recovered. And today we did have another person that was reported as recovered, which is great news. So we're happy to see that when people are recovering, and we know that they are. So we're hoping to see more of those and less of the positive cases as we move forward. That's where we're at with numbers right now.
Has there been any deaths in town due to the COVID?
There have actually been 4. 2 were people that passed away in their homes, unfortunately, and 2 were people that did not live in Westford, but they were Westford residents at one point and passed in their residence where they were. I can't tell you for HIPAA reasons where they were, but there were 2 that were out of town.
That's understandable. So I know that there's sort of predictions that we're going to peak between now and the 20th in Massachusetts.
So yes, the governor's models were predicting a peak between the 10th and the 20th, and today being the 10th would be the start of that window. So if there's anything I could tell anybody at this point, now's the time. As far as our social distancing, we really need to keep our foot on the gas. And for the next couple of weeks, we really need to work as hard as we can to make sure that we are going out as little as possible. We are staying home at all costs. If you have to go to the grocery store, do not go as a family, go as one person. That way, if you are in the store, your exposure level is down to 1. When you're done with your shopping, make sure that you're cleaning your hands. I feel like leaving your shoes outside is a good move. And some people feel like washing their groceries down, which you should do with your vegetables anyway, is a very good idea. So those are some of the things. If you have to go out, take those extra precautions. They don't hurt. Additionally, if you're out, make sure you're wearing a face covering. It doesn't need to be a surgical mask like a lot of people like to wear. It doesn't need to be that. It can be a simple cloth covering. It can be a bandana. It could be a handkerchief. It could be a homemade mask. The purpose of that mask or that covering is we should get away from the term mask. Masks should be used for mainly hospital settings. N95 masks do not belong in grocery stores. They belong on healthcare professionals. So if you're wearing an N95 mask to the grocery store, it's kind of a wasted mask. That's something that could be used in a hospital setting to really save somebody's life. So think about that before you wear those out. But the face coverings, their job is to protect others from you. There are 2 types of carriers of this virus. One is a symptomatic carrier, which has obvious symptoms of coughing, potentially sneezing, sore throat, shortness of breath, things like that. Those people should definitely be seeking medical attention and staying home. The scarier one is potentially a large group of people, and the CDC has not figured out how big this group is yet, but the asymptomatic carrier is somebody who shows no symptoms. They could be talking to you. They could say, I'm perfectly fine. I'm not sick. They can still be a carrier. Those are the people that should be wearing a face covering. If they have that on, they are reducing the transmission of this virus. It is so critical right now to just make sure we're getting to that point. It's going to really help.
In other words, don't be selfish.
Don't be selfish. Just wear a mask out, do your part, be responsible. It's going to help and it will work.
At the recent Board of Health meeting, Ray Dick mentioned that there were 45 restaurants that are closed in Westford, actually closed, not even serving takeout. Can you give us an update on that? And what are the reasonings behind it?
Well, most of those reasonings are economic, and they are making that choice on their own. They feel that it's not worth their time, or they may feel like it is not worth the risk. And both reasons are completely understandable. And whatever they want to do is their prerogative. It's their restaurant. What we're going to do is when we get to the point when we can reopen society to going back out, whenever that date may be, we'll be going into all those places and making sure that their walk-ins are prepared properly, their kitchens are ready to go, they've got fresh food, and they're ready to have us do that. They're really, everybody's really raring to go. But for the time being, we're just going to have to wait a little longer.
Are you doing inspections on restaurants that are currently open?
We're doing restaurant inspections on a complaint or emergency basis. So to protect our staff, we are just going in whenever there's just those two situations. The routine day-to-day inspections, we're not really doing right now as far as the restaurants, just for the safety of our staff and the restaurant staff as well.
That's understandable. So there's some towns in Massachusetts that have put some pretty hardcore restrictions on going out. I read an article this morning that the town of Haverhill, or maybe it's a city, has begun or will begin fining people if they are congregating. What's the town of Westford's stance on that?
So the town of Westford can fine based off of the governor's orders if that does happen. We certainly don't want to be able to do that. And every town has and every city has a different situation. When you have a city such as Haverhill, which is a much higher population than Westford, and as far as population density, I don't know what theirs is. They may have more people doing things that we're not looking for people to do, which is groups of 10 or more. They may have a greater problem with that. We do have people that are doing that in Westford. They're few and far between, and whether it be the health department or the police department, we are doing the best we can to disperse those crowds. I really don't want to get to a point where we're fining our residents for congregating. We're hoping that people just understand this is temporary. It's just a short term, and we can get through this. That's what we really want people to understand. Just take a break from doing those outside activities in groups.
So to wrap it up, Jeff, anything that we haven't touched on that you would like viewers to know?
I think the really most important things is we're into a few weeks of these conditions. Stay the course, keep working at it, keep the group small. There are going to be days where the weather is nice. We haven't closed our beaches yet, and we really don't want to. But if we get to the point we have to do that, the town is prepared to do so. Just stay far enough apart from everybody else and make sure you're not congregating in the groups. The key to winning this battle is the distance. Masks and face coverings don't necessarily give you a level of protection. The main thing is the social distance. When you're talking, speaking, coughing, or sneezing, that's when the virus can be expelled. You don't want to be around that. That's when the possibility is. So that's what we really want people to do. Just continue to work hard at your social distancing. And if you have questions or if there's things you're concerned about, you can call the health department at 978-692-5509. We'll be more than happy to talk to you about any situation you have, any complaints you have, any concerns you have. That's all we're looking for people to do. And just stay positive and keep plugging along. We're one day closer.
Jeff, thanks a lot for taking the time to speak with me today.
Thanks a lot, Patty.
We'll touch base next week.
Sounds good to me.
Okay, great. For WestfordCAT, I'm Patty Stalker.